morning on North Dakota Today. Have you ever heard about something called brain core therapy? Well, Dr. Alan Rudolph is in the Bismarck area, and he joins us this morning from Dynamic Health Solutions in Bismarck to talk about alternative ways to treat brain injuries, migraine headaches, memory loss, a lot of different things. So we're going to get into that in just a moment. But first of all, welcome to the show.
Well, thank you. I'm glad to be here.
All right. So tell us a little bit about yourself and what you do.
So I'm basically a chiropractor, but my specialty is in neurofeedback. The neurofeedback component, it sounds like it's new, but it's actually been around for about 40 years. Except 40 years ago, they didn't have computers, basically, that were small enough to do the computation, so only research universities and hospitals had the capacity to do the research.
And now it's pretty much pervasive.
Yeah. So now, essentially what the brain core therapy is doing is we're looking to see a person's brain has an electrical component to it, and for any given situation, the brain has a neutral or an idle speed as far as where the electrical capacity should be or where the brain wave should be. But in certain individuals, if there's an injury or an imbalance or something happens where now that ability of the brain to adapt, it doesn't work well.
So let me make sure I'm following you and those at home following you. Okay, so the brain in its two hemispheres works on the theory that electrical impulses go back and forth.
Correct.
All over the brain to make us do what we do.
Correct.
Without really thinking about it. It just happens automatic. And so with this, you have the ability to measure those impulses, those waves. Is that what I'm
directly
hearing?
And the cool thing is nothing is going in when we're doing the exams and doing the evaluations. All we're doing is we're already reading the brainwaves that are naturally coming off of your scalp. And so this is a non-invasive type of procedure.
You're not poking your product. There's no drugs involved.
No drugs involved. Totally drug-free, non-invasive. Okay. The FDA has never had any type of serious side effect reported to them. And as far as any type of training or treatment, that's basically rarely ever heard of. So
is this FDA approved?
It is a training method that the FDA has found no serious side effects have ever been reported to them on using that type of training.
How many, well, you mentioned that the universities used to do it, research facilities used to use these, so how many people like yourself are using this sort of technology
with
now?
the company that I'm working with right now, there are approximately 150 doctors that are doing brain core therapy throughout the U.S. and into some of the regions in Central America. But there are other doctors. We'll show you later on. The QEG cap, it's a standard piece of equipment that medicine uses for checking electrical brain waves, except instead of looking for seizure activity or something like that, we're looking for electrical imbalances. We're looking for function as far as how well can the brain communicate with itself and then be able to adapt itself to a given situation. And if it loses that ability, that's when things like anxiety and depression and ADD start to become problems, because now the brain can't rebalance itself naturally. It's kind of stuck in a rut.
Interesting. So again, to emphasize what this sort of treatment helps, we're talking ADHD, we're talking depression, you just mentioned that. What else again?
ADD, ADHD, autism, PTSD,
migraines?
Insomnia, migraines.
Wow.
Basically the whole spectrum of neurobehavioral disorders can potentially be a result of a brainwave dysregulation issue, and which can be retrained. We just use the brain's ability to retrain itself.
All right, we're going to take a quick break here on North Dakota Today. When we come back, I will don the cap and we'll find out more about brain core therapy, so stick around.
River City Roofing is Bismarck Mandan's premier residential and commercial roofing contractor. Whether you need shingles, custom metal, flat work, siding, or gutters, you can trust that you're in good hands with River City Roofing. From teardown to cleanup, you'll be satisfied with the quality of our work. Call River City Roofing today to set up a free estimate. 425-2196. River City Roofing.
We were both just blown away. And that, I mean, both of us had tears in our eyes, because she went from very self-conscious to somebody that was with a smile on her face and realizing that this was just the beginning and it was going to get better from there.
You don't have to live this way anymore. If your thinning hair is causing you embarrassment or keeping you from going out in public, contact Laser Hair Therapy of North Dakota to schedule your free evaluation.
9:23, we're back on North Dakota Today talking about brain core therapy with Dr. Alan Rudolph. So here's the situation. You're suffering, like we mentioned in the last segment. Maybe you've got some ADHD, maybe you suffer from migraines, depression maybe. You walk into your office here and we're going to get you hooked up to this. So show everybody at home what happens.
Okay, so
all right.
Essentially we'll have the patient's just going to hold this up against their forehead.
Okay, all right.
Okay, now I'm going to have you push the cap against your head for me. Yep,
all right.
Perfect, just like that. And this comes right over the top.
Oh my God, you're ruining my hair. That's all right. That's all right.
Now this is
I'm taking one for the team.
Yeah, everyone takes some pictures for Christmas cards for later on.
I look like a pirate.
So, and then we just basically hook this up to a converter, which now nothing is going in from the cap to your head. It's just recording the brainwaves that are coming off of your head. We do.
There are brainwaves coming off of my head.
Correct. Yeah, exactly. So the little white sensors, that's what's picking up a recording those brainwaves that are coming off of there. And so then we plug this into a converter, which goes into the computer, and the computer records those brainwave patterns. And then it compares that against what a normal brainwave pattern should look like. And then from those evaluations, we can then see if you're a person that's coming in with, say, anxiety, for example. Well, we can look to see, well, is the region of the brain that is responsible for having anxious types of feelings, is it overactive? Well, if it is, your anxiety may be a result of an electrical imbalance that we can help the brain retrain itself to calm that down.
What's this one for? What's that wire for?
This is just worn for the initial evaluation and recording. When it comes to training somebody, what we'll do is the cap's not involved anymore. So if we want to train the frontal lobes of the brain, we'll have two sensors that are attached to, or stuck to, pasted to your scalp that are reading those brain waves. And these are just clips that go onto the ear, just simply like this. Which is basically a ground for the sensors that are on your head. Now the training.
So this is something different.
This is two different things.
Okay.
Yep, two different things. The trainings are actually pretty fun. The kids love doing trainings because they can do fun things like watch cartoons. This is how the This is how the training works. When you're hooked up and you're making the right brain waves that we want you to make, you'll be watching a TV show, whether it be cartoons or movies, whatever. But the screen will be nice and bright and the sound will be nice and loud. But as soon as your brain wave starts to alter away from where we want it to be, the screen starts to dim and the sound goes down.
Well, here's my first question for you. You mentioned you compare, you hypothetically would compare my brain waves with a normal brain wave. Doesn't everybody have different brain wave patterns?
To a specific extent, but we're looking at 40 years worth of compiled research of multiple studies done on what normative is. So we have a pretty good grasp of what most people's brains should, in a normal situation of sitting in an office, not having anything else coming in as far as a stressor be, they should have a baseline. And if that baseline is off, part of potentially their symptoms and their symptomatology may be because of that area of being hyperactive or overactive or stuck in neutral.
So this detects where you are as far comparatively speaking to normal brain waves, and then the other therapy is to get you more in line.
Correct.
Am I following you correctly?
You are following perfectly, yes.
Okay. So how much does all this cost? What's the cost?
Initial scans are $125, training sessions are $65. I kind of joke around with parents when they ask, you know, sometimes it costs more to straighten your kids' teeth than to straighten their brain out.
That's speaking from experience, yes. This is interesting stuff. Okay, so where can our viewers find out more if they're interested?
You can find me at my cell phone number is 701-369-3938, or you can email me questions at the email that's listed on the screen. I'll be more than happy to get back and answer any questions that people have. Because it's fairly new to the general public, but it's been around, once again, for 40, 50 years.
For decades, okay. Yeah. Thank you so much, Doctor.
Thank you.
All right, this has been very interesting. Quick break and we'll be right back. Renita's out at Advantage Appliance, cooking it up with Chef Trevor. Stick around.